All right, good afternoon, everyone. So, we're here today to discuss the laboratory portion of the FES and NMES, which I think are the last topics for pay a subject for midterms, for this semester. Okay, so after knowing the other types of electrical stimulation, we will now proceed with the FES or the functional electrical stimulation and the neuromuscular electrical stimulation. Okay. Okay, so the functional, sorry, electrical stimulation, which is also known as FES, is the use of electrical stimulation of the peripheral nervous system to contract muscles during functional activities. Example of these are standing, walking, reaching, and grasping. That's why it's called functional electrical stimulation because aside from the electrical stimulation or the usual ES that we are performing with the patient, you will now do this along with functional activities, okay, which will of course help them to increase their movement and to actually achieve voluntary control over their muscles. Why do we use FES? So first, it is to increase functional activity. The currents depolarize the nerves, which will then lead to sensory and motor responses and will thereby increase muscle strength and control. It is also for us to increase the intensity of rehabilitation because by doing so, you're actually allowing the patient to train at higher contraction intensities because the patient is now regaining strength and again the patient is gaining voluntary control over her muscles or his muscles. And then next is a strong evidence to support its use. Okay, so the statement, another tool in your tool bag is actually if you will be professionals in the future and you decided to do home care services, this is one of the treatments that you can facilitate with the patient as part of your service. The goal for FES is to actually reestablish voluntary control of body position and movement after disruption of motor control mechanisms. The needs to be applied in context of motor learning are as follows. The first is functionally relevant activities, something that will of course allow them to be more functional and to maximize the use of their muscles. Next, intermittent feedback, wherein you are observing the activity of your patient, so that you can provide feedback every now and then, and as needed, of course. And then the last is the client must be an active participant. So we will be mentioning throughout our discussion that active participation is always better than doing things passively with your patient. For the FES paradigms, okay, so this is for you to know the significance of what we're doing when we facilitate FES. We have two types, the independent application and the dependent application. The use of FES for independent, the use of FES for a finite time period to minimize impairments and to encourage motor relearning in context of function. Okay, so the expectation is that the patient will be weaned off FES. So technically, the patient will initially be using FES, okay, along with functional activities, but later on, okay, as the patient recovers, he or she will also decide to stop using the FES because by that time, the patient already regained control, okay, and confidence that the muscles can work without the electrical stimulation. Okay, so that's for the independent application. Now, for the dependent application, we have here that this application enables the patient to perform functional activities that wouldn't otherwise be possible. Okay, so that's why it's called neuroprosthesis. Okay, so things that the patient cannot do without the electrical stimulation will be possible with the help of this treatment. Okay, so examples of that would be picking up and carrying a bag. So if the patient is not functional and strong enough to do such things, okay, there is possibility that the patient can do so with the use of electrical stimulation. And then again, if you know the basics, okay, this is also an important reminder for you. Active involvement in task performance leads to a substantial increase in cortical excitability compared to non-skillful or passive training. Okay, so again, always better to perform things actively rather than passively. Okay, so for the stimulation parameters, we have a number of things that we need to adjust and know when it comes to FES. So first, we have waveform, amplitude, pulse duration, frequency, ramp up and down, on and off time. Okay, so this table shows the complete parameters that we will be using for FES and MES. And it's clearly stated there the different treatment goals that we have. So we start with muscle strengthening, muscle re-education, muscle spasm reduction, edema reduction using MPM, and the amplitude would be to, ayan, naka-indicate naman dyan. And then, okay, we have things like visible contraction, and then, of course, yung enough for the functional activity that you are making the patient perform. And then, important reminders before we proceed to the video is that recent literature review found no relationship between stimulus parameters, duration of treatment, subject characteristics, and clinical outcome. Okay, so this just means that you should use parameters that encourage active participation of the client. Okay, so as students, as someone who is gaining all the knowledge that you need to know about about PT and the different treatment protocols that we do, it's always best that you know the theoretical knowledge behind everything. Okay, but when you meet your patients and facilitate this type of treatments, it is case to case basis, and you will now need to think outside of the box, okay, and determine what your patient needs for that time and for that particular case, okay? So yun yung mga instances that you can deviate from usual parameters, but of course just a little bit. Yung mga things na kaya lang modify, okay? Pero magagawa mo pa din yung pinaka-goal ng treatment mo. What I'm actually saying right now is yung parameters na pwedeng effective sa isang pasyente mo with the same condition cannot be um, the same parameters that are best for your another patient with the same condition. Okay? So, dun lang magva-vary. Kaya dapat alam niyo yung theoretical knowledge behind it. Okay? Tapos, para alam niyo siyang i-adjust and i-modify as needed. Okay? Kaya binigyan kayo dito ng note, sorry, that you should use parameters that will encourage active participation of your client. Okay? Kasi baka mamaya yung feeling mong tama na parameter would be so much for your patient to take na hindi niya kayang gumalaw with that intensity of electric current. So, ang gagawin mo, ano ka lang, magbe-base ka lang sa kaya ng pasyente mo at that moment. Okay? Pero we have certain goals to be met. So, unti-unti, okay, ma-achieve mo din yun. Okay? Pero mas importante na at that moment, kung ano yung kaya ng pasyente mo, dahil importante nga na may active participation siya, kahit papano, yun din yung maging range ng baseline nyo. Some more important reminders would be that the FES is easy to apply if you understand the basics. Okay, so kaya sabi ko, diba, it's always best to know everything. And then next, FES contributes to neural reorganization and plasticity. Kaya usually it's best for neurological patients kasi makikita mo talaga that they're enjoying the treatment kasi hindi nila kayang gawin yun without the electricity. But with the help of electricity or the electrical stimulation that you're doing, nakakagawa sila ng mga bagay na hindi nila nagagawa independently. Okay, and next is the FES should be combined with active movement. So again, from the term itself, functional, okay, the patient will have active participation by doing a functional activity. Okay, and the last is the best practice guidelines support use of FES for hemiplegic shoulder, gait, and upper extremity function. Okay, so these are the best conditions that are best treated by your FES. Okay, so this is an example of your FES. So the patient is actually doing transfers of cone transfers while having the electrical stimulation treatment. Okay, so aside from the ES applied to him, meron siyang functional activity which is transferring codes from one place to another and, of course, facilitating movements, okay, on the upper limb and contracting the muscles that are also being contracted by your electrical stimulation. Okay, so parang nangyayari, you are doing two treatments at the same time, kaya 'di ba, yung effect niya is also doubled. Okay, so that's the mechanism behind it. So here now is the video I prepared for you. Nag-mute na lang ako so that I can explain it while we are watching the video. And you can see here that the electrodes are now placed kasi inuna namin i-video yung NMES. Okay, kaya nakalagay na yung electrodes dyan. Okay, so let's now play it. Okay, so you'll be seeing dalawa lang kasi kami ni Ma'am Ferry. So the camera is fixed. And yeah, so I'm instructing the patient about the procedure, the overall procedure that needs to be done. And since I placed the electrodes on the extensors, what I will be asking the patient to do is to actually do extension. Okay, so let's say that this treatment is the first treatment of your patient with FES. That's why the simplest activity will be done. Okay, pero again, if kaya ng mas functional, mas magandang yun yung gagawin. Okay, this is, yeah, so I instructed the patient to do the movement along with the electricity. Okay, so pag pumasok na electricity, naramdaman niya pumapasok na electricity, that's the time na gagawin niya yung movement na tinuro ko sa kanya. Okay, so ayan, so I instructed the patient by saying such things like, what you will be doing is you will put your wrist like this, okay, and then you wait for the electricity and do this motion. Okay, yun yung i-instruct ko kanina habang dinedemo ko sa kanya yung gagawin niyang wrist extension. Okay? So, again, with the correct parameters, you will begin with this type of treatment. Okay, so let's now proceed with the NMES. I'll be giving you a copy of this one. I think mag-post din si Ma'am Keith para at least mabalikan niyo siya as needed. Okay, habang nag-review kayo. And then for the NMES, we have the neuromuscular electrical stimulation. The definition of this one would be this is the use of this device sends electrical impulses to nerves, and then this input causes muscles to contract. Okay, the electrical stimulation can increase strength and range of motion and offset the effects of disuse. Okay, so it can even offset the effects of diffuse. Disuse. Okay, so aside from increasing strength and range of motion. So this is the illustration of a neuromuscular electrical stimulation circuit. Okay, so the lower portion is your peripheral nerve, and then you have there the positive and negative stimulating electrodes, okay, placed against the skin, okay, which will have an effect, okay, down to the subcutaneous tissue and then even to the peripheral nerve that can now stimulate your peripheral nerves, yes, to facilitate muscle contraction. Okay, so just like uh as mentioned here in the definition, uses a device that sends electrical impulses to nerves. Okay? Kaya, di ba, importante na yung placement yun ng electrodes ay tama yung distance, okay? Being this distance apart from each other para at least yung flow ng current pa ganyan, pailalim siya. And then, kung ano yung target mo muscle, target mong area, madadaanan siya. Okay, and you will achieve your purpose by doing the electrical stimulation. We have electrical waveforms used in NMES. Number one is the monophasic, or kaya siya monophasic kasi from the prefix mono, di ba? One polarity only. Biphasic with alternating polarity. Pulse, okay, isolated pulses of current between which there is no current flow. And then burst, okay, burst of current between which there is no current flow. Okay, so these are the different electrical waveforms. And then again, we have here the table for your parameters. Okay, so that's a quick reference for you para at least pag nireview nyo siya, 'di ba, kayang-kaya nyo maalala yung mga parameters. For contraindications of NMES, of course, there's the unstable cardiac conditions, the implanted pacemakers, acute danger or hemorrhage of any kind, and then acute danger of thromboembolism. Okay? Dahil nga malalim yung magiging effect niya at kailangan ma-stimulate yung nerves, okay? Hindi pwede yung mga conditions na ito, na mga systemic conditions that can, of course, be affected by the electricity. For precautions, there's epilepsy, decreased sensation, no stimulus over carotid sinus, no stimulus across or through thorax, no stimulus over larynx area, do not stimulate diseased skin, prosthetic joint motion restriction, and of course, avoid grounding faults, okay, for precautions. And here is the initial part of our video dahil magsa-start from, ayan, from scratch. Pinlace ko lang yung, yung elbow ni Ma'am Ferry sa towel para at least mas aligned yung area and mas mas naka-stabilize. Oh, sorry. Okay, so let's now watch. Okay, so of course, since this is the initial treatment, you will be needing to sanitize the area. Okay, so even sa mga pracs nyo, kailangan na nakikitang ginagawa nyo yan. Kasi of course, this is to make sure that the area to be treated is clean. Okay, and well sanitized before applying anything. Okay, and then by now, dahil ang dami nyo na naging pracs about electrical stimulation, okay, alam nyo naman na yung way of doing ayan, yung putting the gel on the electrodes. And ako, usually, I don't put a lot of gel kasi nagiging messy. And it is always important to keep it neat and tidy para at least hindi din mawawala yung focus ng electric current. Okay, so I could really say that this is not the ideal way of doing everything. Kasi parang 10 minutes na lang, kailangan na umalis niya ni Ma'am Ferry. Okay, pero ayan. Okay, so basta ang importante is that you have to make sure that the electrodes are in the correct position and to also secure the electrodes in the correct position para at least magpa-functional ka man na kailangan may movement, hindi pa rin siya mawawala sa alignment or sa placement niya. And then, okay, so what I'm pointing there is that I will be looking for visible contractions so that I am reassuring the patient that I will know if the electricity is actually working. Okay. Tinuturo ko sa kanya kung saan ako titingin for observation about the current. But of course, I also instructed her to tell me if she is feeling the current already. Okay, and then again, ayan, so magpapaalam ka every time if you're putting it on a higher intensity para at least na warn yung patient mo, na hintayin niya, okay? And then to tell you if it is uncomfortable. Ayan, kaya every now and then, tatanungin mo siya. And then, the purpose of actually lengthening the video is to actually show you that it is being done in the clinics to observe the electric current and to wait for the response of your patient. Kasi 'di ba after 5 minutes, your tissues have a tendency to what? To adapt, okay, on the electric current. So the patient will not be feeling the same intensity as the initial application. So kailangan nakabantay ka lang dyan. Okay? And then iniwan ko lang yun, ang naging namin na yata dyan yung FES, and then iniwan ko na siya. Okay. So this one is with the FUP. Okay? So, dito kasi, hindi na kami nakahanap ng area to do it on the leg part. Tas naka-pants din kasi si Ma'am Ferry. So, kung ano na lang yung accessible area, yun na lang yung ginawa namin. Plus, ang ginawa ko, if you can see, mas tinaasan ko na lang yung towel in order to show you that NMES with FUP is actually being done with compression and sometimes with elevation din. Pero mas madalas na electricity plus compression. Okay? So, ayan lang. Yun na lang yung nilagyan namin ng area ng bandage kasi it's easily accessible. And, yan. Sinabi namin na i-explain na lang. Okay? For the purpose of video lang talaga siya. Tapos i-explain na lang further with the lecture. Okay? So, ayan. Makikita nyo pag play natin. Okay. Okay. So, I'm making sure that the patient is relaxed. And I am again pointing to the electrode placements. Okay. Sinasabi ko na yung attachment. Yeah, and na-explain ko yung purpose for putting the bandage. And saying to the patient that I need her response more dahil of course covered yung area, 'di ba? Para at least dalawa kami na nagbabantay dun sa pasok ng electricity. And then again, unti-unting pag-angat. And with this one, since it's an FUP with, NMES with FUP, okay, so makikita nyo na hindi man mas mataas yung range ng electricity na ginamit namin so that the patient can facilitate I can what do you call this? Can show signs of contraction. Okay? Even dun sa distal area na nagpipitik yung fingers niya. Okay? And then, of course, dumaan si Sir Bench. Ayan. Okay. So, nakita niyo, di ba, sa loob naka-fix pa din yung electrodes. Ang talagang na-add lang is the compression for the FUP. Ayan. So, usually in the sports clinic, sa mga rehab, sports rehab, what is usually being done is the leg is placed against the wall. So, imagine niyo yung mga basketball players na may swelling and they need to lessen that swelling. Lalagyan namin yung paa nila ng TAs ng ng ES, NMES, and then babalutan namin ng bandage and then itataas against the wall. Okay? Para at least talagang compression and elevation yung combination niya. Okay, so if you see in the video, nilinis ko ulit yung area, sanitize everything para at least to make sure na malinis at walang mag-iiwan na residue dun sa patient. Okay, so I think that's it for the totality of the application of FES and NMES. So, do you have any questions, guys? Sorry. Questions na, no? Ito po pala, nag-add pala ako ng pictures of the other equipment used. Okay, so we have here the TENS med. Ayan. So, yung TENS med, ito yung pinaka-box niya and pinaka parang pouch niya. And then, ito yung isang buong set. 'Di ba? Ang ingat ni Sir Bench, bagong-bago pa tingnan. Okay, so yan yung TENS med. And then, we also have here the very generic Doctron. Ayan. Tapos, eto siya. Okay, so, pagka inalam mo sa mga practices, eto doctrine is best used for TENS lang. Parang TENS lang siya pinaka nagagamit for relief of pain kasi okay naman siya doon. Pero other things like mga burst mode na, parang medyo hindi na ganun kaganda yung niya, effect niya. Pero ito, TENS med, ayan, tsaka yung pinaka-unit na ginamit natin kanina, yun talaga yung mga ginagamit sa clinics. Okay? Tapos, readily available pa yung mga settings. Okay? Yung mga modes. Tapos, para at least, for, lang din, easier application lang din pagka nilalagay mo na sa patient. Okay? So, I think, that's really it. Thank you, guys. Thank you for listening.